Hello and welcome to the final installment of the Money Matters webinar series. I'm Vanessa Laurel with Capacity for Health, and I will be the facilitator for today's session. We have a few housekeeping items to go over before we begin. Participants are currently on mute. If you have not done so, please go ahead and enter your access code and PIN to participate fully in today's webinar. You will find these items under the audio section of the GoToWebinar control panel. Please note that the webinar will be audio recorded and published on our website at www.capacityforhealth.org. This webinar is hosted by, if you have any questions during the presentation, please feel free to use the questions/chat feature. You may also ask questions directly to the presenter by raising your hand, and I will go ahead and unmute your line. This webinar is hosted by Capacity for Health, a project of API-AHF with offices in San Francisco and Washington, D.C. We are funded by the Centers for Disease Control and Prevention, CDC, to provide free trainings and webinars, one-on-one tailored capacity building assistance, and resources in 3 main content areas, which you see on the screen. Today's webinar falls under the Organizational Infrastructure and Program Sustainability section. We also do work in other component areas such as evidence-based interventions and public health strategies and monitoring and evaluation. We are very pleased to have Linshuang Lu join us today and present on the topic of financial management. Linshuang, will you go ahead and please introduce yourself?
Sure. Welcome, everyone. Thank you very much for tuning into this webinar. Just to give a little brief background on myself, I work for Praxis Consulting Group in Philadelphia. We're an organizational development firm that works for mission-driven organizations. So for us, that means organizations that are nonprofit, employee-owned, or socially responsible businesses. We do everything from financial education to strategic planning to leadership development to help board and staff better engage in their work. I personally have a business degree from the Wharton School of Business, and I've worked in for-profit strategy consulting, but I most recently spent several years working on the consulting side of nonprofit finance fund before joining Praxis. I also just wanted to mention that this is the third of a 3-part series on Money Matters. The first webinar covers basic financial literacy. This is a great webinar for anyone who wishes to brush up on the basics of nonprofit accounting. And then the second webinar focuses on the board's role in financial governance. So I do encourage, if you're interested in either of those webinars, they are available or will be soon be available on Capacity for Health's website. So to get started, I am going to go ahead and pull up my screen. I usually like to think about financial management as falling into 3 primary areas. And to explain these areas, I like to use the analogy of a car driving to a destination. So the first area is controls, compliance, accounting, and reporting. This is comparable to making sure that the car works, right? That the ignition is functioning, the brakes are not worn out, the oil change is up to date. This relates to how you process your payroll, how you make payments to vendors, receive revenue, handle cash, and track all of this in your accounting system. It's the kind of day-to-day nitty-gritty of financial management. So as a program manager, you won't be setting these policies yourself, but you'll have to comply with what's been set by senior leadership and the board. The second area relating to financial management is budgeting and monitoring. So I like to say that this is a lot like learning the traffic laws and how to drive. So how do you steer? How do you park? How do you change lanes safely? This is usually the biggest finance-related responsibility that you have as a program manager or program staff. So we'll spend the entire latter half of this webinar focused on this area. And finally, the last piece is about determining your program strategy and your business model. It's about figuring out how to run an impactful program that's financially viable. So this is about knowing where you're going, how will you determine your destination, and know what direction or what streets you're supposed to take to get there. Some people might think of this as being more of a leadership task or a strategy task as opposed to a financial management task. But I like to include it here because you can have the best financial management skills in the world, but without a solid financial and programmatic strategy, you're not going to be successful. So I actually just want to take a pause on this webinar because we just had 2 new people sign in, and I would love to have both of you introduce yourselves So wondering if you can actually type into the chat box, your name, what organization you're with. A rough ballpark estimate of your organizational size. Is it a $500,000 budget, $1 million budget? And then also if you could say, what's your role? Are you an ED, a board member? Are you a program staff that has budgeting or finance responsibility? Or whether you're just program staff without those responsibilities. So actually, if you could just type those in the text box, that would be great, and then we can see who's kind of listening in. And for those of you who just missed the beginning of this, I had just given a basic introduction about myself, and then just mentioned that this is actually the third of a three-part series on financial matters, and that the first one covers basic financial literacy. So that's really good for anyone who wants to brush up on the basics of nonprofit accounting. So Vanessa, I'm wondering if anyone responded to the introductions question?
No, not yet. Maybe a couple more minutes, or
I guess I asked as many questions all at once.
Okay.
So I'll keep,
we have one. We have Kathy Kapua on the line. Hi, Kathy. Vanessa here. She is a program staff from Life Foundation in Honolulu, Hawaii, and they have around 30 staff members.
Okay.
Thank you, Kathy.
I'll keep going, and Vanessa, if the other person responds, let me know. And thank you, Kathy, for joining us. And we do have a very small group today, so please feel free to interrupt me and ask questions whenever you want. The best way to do that is to actually either raise your hand or send Vanessa a message so she'll know. And Vanessa will either interrupt me or I will pause regularly for questions.
Sure.
So going back to this idea of program strategy and business model, for those of you who are program staff, learning to understand your program and your entire nonprofit's business model is going to help you contribute more effectively to the organization and improve your leadership ability. And for those of you who are EDs or board members, allowing program staff to understand the bigger picture around finances is going to enable them to contribute better ideas and better understand some of the difficult decisions that have to be made. So, the big picture, why bother with financial management at all? Well, we want strong financial management because we want financially healthy programs. Financial health isn't going to guarantee program success, but it will support it. Not having financial health is obviously going to detract away from program success. You're going to be distracted, worried, and anxious, and probably not able to focus on program quality or long-term strategies because you're going to feel like you're putting out all these fires in the short term. As they say, money can't buy happiness, but not having enough money for your basic needs is going to make you quite miserable. So your program has a business model. And by business model, I'm referring to a way that it works financially. I'm not talking about a fancy Excel model. I'm basically talking about a simple way to talk about how your program runs financially and how it works. I find it helpful to break it down in a couple of main areas, and let me illustrate this with an example. So let's just take a straightforward case management program for individuals living with HIV. Your organization has caseworkers that then works with individuals that have HIV, trying to connect them to the proper medical and housing services. So the first piece you want to ask yourself is who do you serve? Who are your beneficiaries? So in this case, this is people living with HIV, probably in your local region. The second critical piece is asking, how do you generate revenue? Who pays for these services, and what motivates these people to pay for these services? For an HIV case management program, a lot of times your customers are not the actual people who pay for the services. It's a third party that does that. So a lot of case management programs are government funded. So the government might see these case management services as a valuable social program or a government service in order to ensure basic dignity and care for all people. The government might pay your case management program to do it rather than do it themselves because you have more capacity, knowledge, and community connections. It's also likely that the government funding isn't going to cover all the costs of case management, so you'll have to obtain additional funding from local foundations who find that providing money to your program fulfills their mission of funding health and human services. And maybe they like to support your program either because they have a really good relationship with your leadership or with you and they trust you, or you might just have the reputation for being the best provider of these types of services in the region. So that's really the revenue side. It's thinking about who contributes the revenue and asking yourself why they give you money. And then expenses and assets go together. This is about how do you provide your services and programs. So with a case management program, it can be fairly straightforward. For expenses, you're looking at salaries, maybe telephone lines, computers, and maybe some office space rent. But if you do more home-based case management, so if your caseworkers are kind of going out into the community, this might look a little bit differently. You might have less office space, but you may have more cell phone or more travel expenses. And then if you're not, sure.
Linshuang, oh, sorry to interrupt. We have Natalie Sanchez from Ultimate Health Services Corporation, and Natalie works with a $200 million budget, and this person is a grant writer and develops program budgets for proposals and renewed grants.
Okay, great. Thank you for joining us, Natalie. So just to kind of go back to what I was saying before, your business model is going to be more complicated if you're actually providing housing, residential, or medical care. This might get more complex, especially on the asset side of things. So ideally, your program is going to be financially sustainable on its own. Its revenue is going to cover its expenses on a regular basis. But that doesn't always happen, right? Some programs are less financially successful than others, but the nonprofit as a whole is going to need a sustainable business model. But many people find it helpful to plot their programs along this dual bottom line matrix as they think about where their program fits in. So this is adapted from a book called Financial Leadership for Nonprofit Executives by Jeannie Bell and Elizabeth Schaefer. And it's pretty straightforward, right? So the x-axis shows financial sustainability. The y-axis shows mission impact. So if you have a STAR program, it means it's a program that's financially sustainable and mission aligned. So if you're overseeing a STAR program, that's great news. And the important thing is actually to not get complacent about it, right? As the environment is changing, you have to make sure that you're able to both keep that mission alignment as well as that financial sustainability. A lot of programs fall into the heart area, so they're programs that are critical for your mission success, but they're not necessarily financially sustainable. So this could be free HIV testing, maybe some of your prevention programs. They're mission critical, but they don't bring in a lot of additional resources to the organization. If your program falls into the heart area, it doesn't necessarily mean that you haven't done your financial management job properly. Most nonprofits have program areas that are heart programs. They need to be subsidized by either grant writing or other programs in the organization. So if your program is in this area, you might want to focus on how you can make it more sustainable or support others who are subsidizing this program. So that might mean making it easier for the ED or the grant writer to raise funds, or finding ways to make that program more cost-effective. Now, dollar programs are more tricky. From an organizational standpoint, they seem wonderful, but if you expand too much into the area, you really run into a lot of mission drift problems. So one of the examples that I've shared in one of the previous webinars is that there was once this after-school programming organization that did a lot of confidence-building programming mainly for young girls in schools. And over time, they started receiving some case management work for adolescents out of juvenile detention. And more often, their case management work started to grow until they became known in their region for providing case management services as opposed to after-school education programs. In the past couple of years, that case management money has started to dry up, so the organization is scrambling to revive its education programs. But the challenge is now that it's become known for case management and not for after-school education. And it's really facing a situation where it really needs to rebrand itself. So once again, if you're in a dollar program area, that's a tricky place to be in. Right? You may want to think about if there are ways to align what you're doing more closely with the organization's mission. Maybe for that case management organization I was talking about before, it may have meant getting those girls in the case management program more involved in the after-school education programs. Now, question mark programs. That's a very tricky area if you find that you're a program staff in one of those areas. Sometimes it happens, and a lot of times you find yourself in a program that's neither mission aligned nor financially viable. And it has nothing to do with your own skills or your own ability. It may have been decisions that were made by others in the past. but it's possible that it may not be in the long-term interest of the organization to keep that program around. And if you're in that position, you want to think really long and hard about either how to improve the mission alignment or financial sustainability of your program, or maybe determining a graceful exit strategy, finding another partner who can take over the program or scaling down the area. Obviously, that's complicated because your own livelihood could be affected, but sometimes these programs can derail an entire nonprofit organization. I've worked with several organizations before that just had too many of these question mark programs around, and eventually the nonprofit had to shut down for 6 months as it kind of reinvented itself. One organization we encountered was a basic social service community agency. I think they only had about 14 staff, and they were trying to run after-school programs, a food bank, counseling, and foster care services. So it was far too much for that size of staff and that size of an organization. And eventually they had to basically decide to cut 2 of those programs and focus just on 2 areas. So if that's the case, if you're in that question mark area, it's better to be involved in a strategic effort to address what to do with that program rather than just be on the receiving end of the decisions that are being made. So let me take a pause and see if there are any questions. And if not, I'll keep moving on. All right. So whatever area your program falls in, and I know one of you is a grant writer that does, I guess, grant writing for a lot of different programs, you always want to be thinking about how can you make it more financially successful. So, I've worked with a lot of organizations in the past that were facing deficits and, trying to figure out how to change things. And the bottom line is that there's no magic formula to making a program financially work or for making a nonprofit more financially sustainable. It's a hard thing to do, and there's only a certain number of things that you can really play around with. But it's good to go through all of these and think about what your options are and where you might want to dedicate some of your time. So the first option is obviously to increase earned income. So there's lots of different ways to do that depending on what your revenue streams are. So if you have any sort of fee-for-service programming, some organizations have tried a sliding scale to see if they can collect more money from people who are able to pay more. Other times people will start collecting more nominal fees for some of their events or having kind of suggested donations or suggested fees. The other way to improve earned income is to just try and improve attendance at some of your programming, to have better outreach and marketing to get more people attending your conference, especially in a situation like that where your costs are pretty much the same no matter how many people attend. But if you get more people to attend, that's a lot more revenue for your organization. For those of you who have performance-based contracts, obviously if you're able to improve your performance, that will also bring in more income to the organization. And in that area, it might be a bit of a cost-benefit analysis. So thinking about if there's additional things that your organization might be able to spend money on, but if it improves impact, it may be a net positive for the organization. The other big area is obviously you can increase your fundraising. Once again, that can be challenging in this environment, but it is an option for increasing resources. Starting with people that you know is always best, but I found that a lot of organizations have found it helpful to think through the beneficiaries of their services. So thinking through alumni, families, other friendly organizations, or even indirect organizations that benefit from your organization. So that could be local businesses that might benefit from the influx of traffic in your area. Thinking about improving fundraising relating to your program may also mean that you should coordinate with others in the nonprofit just to make sure you're not trying to compete for the same funds or that you can align your strategy together. And then I think the other key thing about this area is that, and for all of these areas, is that you do want to think about what you focus on. You don't want to spread yourself too thin trying to raise money through 100 different avenues when you may have a better payout in 2 areas. And finally, cutting costs is often a way to make a program more financially successful, but it is an area that you have to be very, very careful about. There's often a very limited payoff that you can get without affecting quality. I think the area where I've seen things being most successful is actually in sharing back office operations. So having a shared bookkeeper with another organization or sharing some of the back office stuff that isn't at the front line of your organization. A lot of organizations have also found themselves in this situation in the past couple of years due to various funding cuts that they have no choice but to make huge drastic reductions to their costs. And in these cases, people have found that they really need to focus on what's core to their organization, what's core to their program, core people, core assets. It may also mean kind of examining what are the other organizations or programs in the area and figuring out what makes your program unique in your community and making sure that you preserve that. And then finally, the last route that many organizations have been taking, and it's not necessarily something, I guess it's less about being more financially successful, but it's more a question of figuring out how to do more with less financial resources. And that's trying to find a different way to achieve your impact, trying to find a different method to provide program services or to meet your mission. So the best example I have of this is the Philadelphia organization called Need Indeed. And for a long time, they used to do project-based service-based projects at public schools in Philadelphia. And so they would have, different classrooms come around choosing different service projects to do in the community. And Need Indeed would have their program staff run these programs in different schools. And then this organization decided that they really wanted to expand their impact, but they just couldn't get the financial resources to hire more program staff to run these programs in different schools. So eventually they decided to really change their model of providing service, and what they ended up doing is they started a teacher training program. So instead of having their own program staff do these programs in the public schools, they were actually training whole networks of teachers to be able to do it themselves. So as a result, they were really able to greatly increase their impact, even with less financial resources. I've heard also that a lot of nonprofits who are now needing to reduce costs are really focusing more on partnerships. They're really trying to connect better with other nonprofits in the area, making sure there aren't redundancies, making sure that they collaborate in a better way. So, once again, from a program perspective, financial sustainability is not necessarily critical if the rest of the organization is strong enough to support your program. But it is something that you need at an organizational level to stay around. And improving an individual program's profitability is always going to help support the organization's financial health. So let me pause there and see if there are any questions. Got a quiet audience. So I'll move on again, but once again, please do feel free to ask questions if anything comes to mind. So I know I've been talking a lot about financial sustainability, and I think I want to spend a little time talking about how I define it. And different consultants and different organizations will define it slightly differently. But I like to think of it as ongoing program profitability. So an ongoing situation where revenue is going to cover expenses. But the nitty-gritty of calculating that program profitability can be very confusing. So there are two main ways to think about program profitability. One is direct costs. So that's basically asking yourself, what revenue and expenses are directly attributed to having this program around? So if you take that case management example earlier, this might be the office space for the case managers, their salaries, maybe the supervisor who oversees that program, the computer systems and phone lines that the case managers use. These are the direct costs. And then the revenue associated with that might be related to the additional contract revenue that you get from the government for providing case management. You can also take a look at a full cost analysis of program profitability. So that's basically taking your direct costs and then adding in the overhead allocation. The overhead allocation accounts for the fact that an individual program uses common organizational resources. So the organization has a website, a bookkeeper, the executive director does fundraising for all the programs, and this individual case management program uses those resources. It's hard to figure out exactly how much this program uses, but it's usually estimated by an overhead allocation. So that's usually taking all the overhead expenses that an organization has, adding it up, and then allocating it to the programs either based on salary, their space usage, or their total expense usage. And a program might be profitable before overhead expenses are applied, but not after overhead expenses are applied. So I have an example on the right side of the screen. And this is with an organization I worked with about 1 or 2 years ago. They are a private nonprofit school, and they have an early child care program. So you can see in this example that their revenue was about $115,000, mostly tuition, some grant money, and their expenses amounted to about $95,000. This was before overhead allocation, and so this program was actually having a net positive contribution to the organization. But once you apply the overhead, the cost of maintaining the building, where they had both the child care program and the school, as well as the school administration, this organization was showing a deficit. Now, what was very challenging about this organization was that they didn't break out the overhead separately. It was actually embedded in all the other line items. And so for the longest time, this organization actually thought their early childhood program was losing money. And in a way, it was, right, from a full cost perspective, but not from a direct cost perspective. So it's important when you're thinking about your different programs that you distinguish between the two. Sometimes you might want to think about direct costs. And that's maybe when you're thinking about whether or not to keep a program around. So in the case of this nonprofit school, it actually was a better idea for them to keep the early childhood program around, because most likely if this program wasn't around, they would still have to maintain the same building. They probably wouldn't be able to rent out that space, and they would still have the same administrative staff as they did before. So as a whole, this program actually had a net positive contribution to the organization. That being said, as a general rule of thumb, when you're communicating externally or talking to potential fundraisers, you want to give them the full cost number, right? You want to give them the larger number to reflect the fact that it's not just the direct costs that are used to run a program. There's also these common overhead costs that are also associated with it. So just be sure you know the difference between the two and know which number you should use depending on what the situation is. Let me pause again and see if there are any questions. And if not, I will keep going. But please do feel free to interrupt me if there are questions. So I've spent a lot of time talking about the big picture. I just want to spend a few minutes talking about financial policies and procedures. So your organization should have policies about how to handle basic financial transactions. And the thing that I really want to emphasize is that you should follow them, right? They might be annoying, but they serve a purpose. They generally prevent fraud and mistakes, and they make sure that there's good financial information that an organization can get out of your program. It's also important to keep in mind that policies are not always perfect, so you want to be aware of any weaknesses in your procedures, and feel free to suggest changes to the policies if that's the case. In general, you want to make sure there's separation of duties, so there's more than one person handling cash, more than 2 people are signing checks, and so on and so forth. And then you should make sure you report suspicious activity quickly and quietly to the appropriate person who can initiate an investigation or address it more formally. A lot of times for staff, you may report to HR or to the executive director. If you're the executive director, you may want to talk to the board about it and then initiate the investigation yourself. Many organizations will have a whistleblower policy that will protect you if you end up raising a situation where there may be potential fraud. But if it doesn't, I think it's still important to try and talk to someone about it. The other benefit of following these procedures is they can actually improve the financial health of your organization, especially on the cash flow side. So making sure that you're able to get your invoices in on time can help bring cash into the organization faster, makes it easier for people to meet payroll and pay bills, and is generally better for the organization. It also helps, following a lot of these procedures can also contribute to better financial information for the organization, which lets management make better decisions and have a better idea of what's going on. Any questions or comments? All right, well, I promised that the latter half of this webinar would be on budgeting and monitoring, so let's dig in. One of the challenges of putting this together is that each organization has a different approach to budgeting. So I'm not going to spend too much time getting into the nitty-gritty Excel spreadsheets. What I want to do is kind of share some of the different ways that organizations budget at an organizational level, and then talk about specific strategies that programs can use to budget for their own areas. So let's first talk about organizational-wide strategies. There's kind of 4 different approaches that you can kind of group things into. One is a goals or outcomes-based strategy. So that means that leadership will specify the type of events or services that they want a program area to provide in a given year. So it might be for the advocacy unit. You're going to organize one conference, do 3 advocacy events, and start a social networking strategy. Or it could be that we want this program to serve 50 case management clients this year. And then each program area is going to have to figure out how to make that happen. A lot of organizations also use a top-down financial goals method. That's very, very common. So basically, each program is going to get a combination of revenue goals and expense targets. So you might have senior leadership tell you how much revenue you get out of the general fund and how much you're expected to raise. Or they might give you a specific budget number for running your program. So maybe you get $100,000 to operate a needle exchange program. Some organizations also use a more bottom-up method, and this often happens with national organizations that have regional offices. So each program area will actually start their budget on their own and then report up what is the revenue they think they can raise and what their expenses are. And then finally, there's zero-based budgeting, which is kind of the most radical of all these approaches. To do true zero-based budgeting basically means you kind of throw out how you've done things in the past and entirely rethink how your program is going to run. In my experience, I actually haven't encountered an organization that's done this when things are operating regularly. I have seen organizations do this when they find themselves in a turnaround situation where they have to completely rethink how things work. But it's very radical. It requires a lot of time and risk. You know, there may be a different way of doing your program, but what if it means laying people off? That's a very tough decision to make. That being said, zero-based strategies is what people use when they need a turnaround situation, when they need to rethink how they're going to do things altogether because what they've done in the past isn't working. Or if you're about to start a new program, you're basically doing zero-based, right? Because it's never been done before. How are you going to do it? And in any of these strategies, senior leadership should provide some basic guidelines to help you along. So they should have some timeline, set of deadlines. Hopefully they'll have some sorts of templates or forms so you know what the general format of your budget should be submitted in, and there may also be room for you to write narrative or justification for what you're doing. And they should also provide some sorts of general guidelines. So it may be that this year there can be no raises that are more than 3%, or it may be that there's actually a pay freeze this year, or something along those lines. If you're in a smaller organization, this might be a lot less formal, but you do want to make sure that before you really get into the numbers of budgeting, that you have some idea of what senior leadership is looking for. And then the final piece is to expect budgeting to be iterative. There's a lot of back and forth to make things work, so generally budgets are not going to work out on the first draft, so don't expect it to. Try, give it your best shot, communicate, ask questions, discuss, and revise as needed. So let me pause again and see if there are any questions. I would also love it if people wanted to kind of just type in what budgeting model does your organization tend to follow. And a lot of organizations actually do a combination of all of these methods depending on what the program is. So maybe if there's a big program area, that might be more bottom-up. That program almost operates as an independent nonprofit, is responsible for bringing in their own revenue and paying for their own expenses, whereas a smaller program might be more top-down. So maybe the organizational leadership has secured one grant for this program, and they're giving that program budget for the individual to draft how they're going to do things. So, Vanessa, I was just wondering if anyone replied to that question, or if I should move on, or?
No, no one replied just yet.
Okay. Well, that's fine. Sometimes this is like a little bit of an abstract exercise, but it's just to kind of give you an idea of what senior leadership is thinking about as they try to figure out what to budget. I'll keep moving, but Vanessa, if anyone does answer, please let me know, or you can just send me a chat message. So I'm going to be kind of going through a lot of different ways that program managers can budget for their own areas. And the biggest thing that I'm going to emphasize is that budgeting is not just about the numbers, right? It's not about filling out an Excel spreadsheet or a form. It's about actually figuring out how you're going to run your program. And so in a lot of cases, it's going to be very similar to the prior year. So the prior year budget is actually a really good way to start. So I'm going to jump to an example, and then I'm going to come back and talk about some of the other things on this slide. So this is a sample budget for a community education program, and they do direct prevention education, so they have a lot of classes that the program staff will provide themselves. But the program staff also works with other community organizations that want to establish their own prevention or education programs. And so this is This is obviously, I tried to do a budget that was just going to be big picture, right? So an actual budget is going to be a little more detailed than this. But the basic structure and idea might be similar. So you have your 2011 original budget here, and then I have a 2011 projection. So basically the idea is that, say you're on a June 30th fiscal year, now that it's close to the end of the year, you might find out that your original budget needs to be revised. And so you may have a projected version that shows those revisions. And then there's a draft, I guess, for the 2012 budget. And then there's also a column to see what the increase is between the budget and the projection. And then there's a column with notes in it that show what those changes are. And so you can see that a lot of it is just thinking through what's happening logically. So you can see that the program director had a 3% raise for this year. And then the program staff, there were some staffing changes. So it looks like the amount was lower than expected because someone left, and so they didn't have to pay as much salary. And they might be able to hire someone in at a lower salary for next year, which accounts for that decrease. The other program staff is sticking around and is getting that 3% increase. And then for the other items, it's thinking through what's going to happen in the next year. So health insurance and premiums might increase, but maybe their supplies have declined because they've managed to find other people who are able to donate supplies to the program. But then on the flip side, they're finding out that maybe space and rental rates are increasing for the next year. So they're going to expect it to have to pay more in that area. And then gas prices are higher, so that area is also going to be an area with increase. So this budget is really, really basic. But the idea is that you sort of start with the previous year and kind of ask yourself what's going to change. And then there's a story behind it, too, about, what exactly is going to change, and then you kind of translate that into concrete numbers. You probably need to do a little research on exactly what those changes are going to be. I did get a response for one of my previous questions, which is that Life Foundation has a top-down goals, outcomes, and top-down financial goals. So it's a combination, I think, of the senior leadership of the organization either setting goals and outcomes as well as financial goals that the different program areas then have to fulfill. So thanks for your response. So kind of going back, so that's kind of the method that I just walked through is a method that a lot of program areas will use, especially when they think that things are going to be fairly similar to the previous year. But if you're doing a new program or a new project, you're in some ways asking yourself the same question. How are you going to do it, right? If you're about to start a new community outreach program, do you need new staff for it? Who's going to be hired? What other resources? Marketing, supplies, travel, what else are you going to need? And then once you have a mental picture of how it will work, you can then research vendors, figure out reasonable salaries, talk to other peer organizations for details. The basic point is that you want to think about how it's going to work operationally before you get really stuck in the numbers. And I know that, especially with new programs and projects, a lot of times you do have a ballpark number of how much revenue you have to work with. So a lot of times as you're thinking about how you're going to make things work, you might want to use that as a checking point so you don't come up with a way of running your program that way exceeds the budget that you have available. Another common method for doing your budget is to think about how much service you're going to provide. So for instance, say you provide free HIV testing in the community. First of all, you might have a good idea of what your fixed costs are. So these are the costs that generally don't change depending on the amount of service you provide. So this could be the van that you use to drive around to different communities. It could be the staff that provides this testing. And then maybe the kind of basic equipment costs that you have. And then you also have the variable costs. So these are the costs that change depending on the number of tests you conduct. So maybe and I actually apologize, I have no idea how much it costs to do an HIV test. But let's say it costs $10 to run an HIV test. So your key is actually to kind of project how many tests you think you're going to conduct. And maybe you can estimate that based on prior year track record, different neighborhood trends and outreach efforts to get a ballpark estimate of how much you might be able to spend, how much you're going to spend in that area. Just a couple other tips relating to budgeting. First of all, this seems really obvious, but sometimes it's tough to do. Be realistic about your costs. Don't try to underestimate your costs. It's better to overestimate than underestimate. And a lot of times people will actually build in contingencies to their budget. So make sure you don't budget away every single dollar that you have, because things always change throughout the year, and it's nice to have a little bit of cushion. It's also, you might want to think about long-term investments that you might want to make in your program. So these might be expenditures that you're not going to make in this year, but you may want to make 2 or 3 years down the line. So this could be new equipment or potential staff or other types of programming investments that you want to make. Depends on what organization you're in, but sometimes there's a possibility that you can actually save some funds within your program to do that. So if you have a few extra dollars to spare, you can ask to see if that can be saved for some purpose in the future, for something more significant, hiring a staff person, hiring a grant writer, or kind of having a new software to manage some of your programs, rather than feeling like you have to spend down every single dollar that you have. So let me pause and see if there are questions. All right, well, I'll move on then. So the revenue side, so expenses, budgeting expenses is an operations exercise, right? It's like, how do you run your program? Revenue is a lot trickier to budget because it's about predicting what's unpredictable. So a lot of times, it's helpful to just take it one step at a time. So you start with what you're certain about. So that might mean that you have a solid pledge from the foundation. Maybe you have a 3-year government contract that you know isn't going to change. So you start with those sources of revenue and you include them. And then for your uncertain areas, you're going to have to make your best educated guess, right? So maybe you're pretty sure that there's going to be 20% cuts in government funding. Or you've seen a trend in increasing donations in the past couple of years. So you think that they will probably still increase for this next year. Or for something like conference registration, you can guess based on your prior year what your new recruiting efforts are, what your membership base is like, and then general economic trends. So there's a variety of different ways that you can think through and try and predict, what your revenue sources will be. Even in the for-profit sector, that sometimes, it seems like they have a lot easier time doing this financial management piece. They also face the same uncertainty because they don't know if their sales are going to be as high as they predict they are. So everyone really does have to make their best educated guess. And then obviously, when you're done making an estimate around your revenue, you may have to go back and revise your expenses if you find that your revenue isn't covering your expenses. So this could also be an iterative process. I think a lot of people, once they're at this point, they also feel very nervous around their budget because there is still a lot of uncertainty there's still a lot of uncertainty in it. So a lot of people actually have ways that they will represent this unpredictability. So scenario budgets are a really, really common thing that different programs and organizations have used. So you have an alternate budget in case a major grant or major contract goes away or has drastic cuts. So it's basically having a backup plan in place that you know you can revert to if that's the case. So it's going back to that operations idea. So you think about how things are going to run in kind of the base case scenario, and then you think about how you're going to do things in the worst case scenario. The scenario budget could also have an upside, right? It's not all bad news in the past couple of years. So maybe you want to think through what you're going to do if you get an extra grant or an extra funding more than what you expected, what extra service or what extra investments you can make with that. And then another piece of it is just making sure that you are very clear in your notes about what your assumptions are. And then another method that people like to use is actually to assign probabilities to different revenues. So I'm going to kind of walk through this example with you here. Once again, this is a very big picture, representation. Obviously, for an actual organization, this is going to be much more detailed. But the basic idea is you have 2010 and 2011 are still showing your prior year budgets and actuals, and then you have your budget in 2012. And there's actually a column where you'll assign a probability to each of those revenue sources. So some organizations will actually have you assign like a percentage probability, and others might have you say this is A revenue or B revenue, or this is a definite win, this is a warm, this is a watch. And then you'll have a probability adjusted revenue column. So there's a 90% chance that you'll get the CDC program grant. They'll adjust that revenue downward for your revenue number. So you can see that in this budget, they've applied different types of percentages to different revenue sources depending on what the situation is. So for the Very Nice Foundation, down a couple of lines, they have a really good relationship, long-term commitment, think that they're going to sustain the same amount of funding, but they also know the economy is bad, and so that they may be cutting back all around. So there's a probability of 80%. Maybe XYZ Foundation has been showing more interest in this organization in the past, and you think that they're going to start giving more money, but you're not really sure. So there's a 50% probability assigned to it. And then for board giving, you've really made a huge effort to increase board giving in your organization, and so you think that it's going to be even better this year. So there's a 90% probability assigned to that. So there's all these different kind of assumptions that go into what you think those probabilities are, and at the end you get a kind of weighted total. I actually have to say that I'm personally not a huge fan of this method, but I do know a lot of organizations do something similar to this, and they like it a lot. It tends to work better when you have a lot of different funding sources. You're dealing with a large organization, because I think that the different probabilities kind of balance each other out. But if you're in a situation where you only have 1, 2, or 3 major sources of funding, it may be better just to do a scenario budget to see what will happen if any of those sources go away or have dramatic cuts. Let me pause and see if there are questions. All right, I'll keep going then. So another budgeting exercise that's helpful to do, depending on what your program is to do a break-even analysis. And basically the idea behind that is having a target in your head of knowing how many people do I need to serve in order to break even, or what types of performance metrics do I need to make before I'm going to break even. What outcomes must I achieve to cover my costs? So let me walk through an example. So let's say you run a residential care program. So you're kind of putting together what your rough budget is going to look like. So you look at your fixed costs first. So these are costs that are not really going to change depending on the amount of service you provide. So this could be your full-time program staff and then the kind of rent associated with your building. So let's say that's $400,000. And then there are overhead costs for ED time, bookkeeping, accounting, all that other stuff, another $50,000. And you also are able to raise $100,000 from grants and individual contributions towards this program. So that basically gives you a gap of $350,000 that needs to be covered. So you might want to try and figure out what your break-even service amount is. So maybe for each client that stays with you each night, you're able to bill for $50. And then for providing care for that client, the additional cost or the variable cost for that client is $25. So this accounts for the fact that if you have one extra person stay with you, there's extra food that you have to pay for, there's laundry, additional utilities usage, so on and so forth. So basically your gross margin per client per night is $25. So that basically means that the kind of for each additional client that stays an additional night, because there's a $50 fee associated with that, but it only costs you an additional $25 to provide the service, you actually realize a contribution of $25. So you can take that number and compare it to the $350,000 to figure out how much service you're going to need to provide to cover that $350,000 gap. So in this case, you take $350,000 divided by 25. Actually turns out to be about 14,000 client nights that you need in a year. So that ends up to be about 38 or 39 people per night for the year. So it's just a useful exercise to do. I've seen other organizations do it maybe with the kind of performance outcomes if they have a performance-based contract, because it really gives you a good idea as the year is going on, what's the service amount that you need to be meeting to cover your costs. Kind of what are the different indicators that you should be monitoring. Let me pause again and see if there are questions. Okay. So I know I'm going through a lot of different examples, but it's really, there's so much diversity in terms of how funding sources works and how programs work that there's different strategies that you're going to have to use, and it's about figuring out what's going to work for your organization. So a lot of times for your program or for your organization, you actually have to match your expenses to your funding sources. This is especially the case if you have restricted grants or reimbursement contracts that are only going to pay for specific things. So one way to think about this is you may actually do your kind of total column first. So thinking through how you're going to run the program, thinking through what are your likely sources of revenue. And then you're kind of going to do a bit of a matching game. So going through each of the funding sources and figuring out what they'll pay for. So for instance, say Contract A and Contract B are both reimbursement contracts. So Contract A, however, only has an 8% overhead coverage. So, oh, I'm sorry, made a mistake. An 8% overhead allocation. So it'll cover all the direct expenses, but it won't cover all of that overhead. So you'll see under Contract A, there's a deficit at the bottom of $39,000. Contract B is also a reimbursement contract, but there's a 15% admin piece to it. So this is actually able to cover all the overhead costs. And then Grant Z asks you to provide a specific amount of services for a specific program, and you can pretty much match that money exactly. There's a $600 off at the end, but it basically covers it. And then for your program, you also have some additional fundraising that goes into your area to cover those costs that you can't charge off to individual grants or contracts. So depending on the nature of your funding sources, you may also need to take your budget and be able to figure out which expenses are going to be charged to each grant or each contract. Let me pause again and see if there are questions. All right, moving on again. I know I've spoken about overhead allocations again, so I just wanted to kind of walk through what it looks like at an organizational level. So this is not a program budget. It's actually a budget for an entire organization. And once again, it's not as detailed as what you'll normally see. And you'll see that there's 3 columns for each of the programs: direct care, education, and outreach. And then there's a column for overhead, and then there's a total column. And so you'll see that if you look at that first surplus or deficit line, the one with 84,000, 38,000, 3,000, and so on, you know, most of these programs are actually having small profits on a direct cost basis. But this organization also has 128,000 overhead. And so you take these overhead costs and you kind of apply them across the programs based on how much expenses they have. And then you have a better sense of what the profitability is after the overhead allocation. So this is just a kind of an idea of what it looks like at an organizational level. And different organizations will represent this in different ways. I like it when the overhead is broken out separately because then you don't run into that problem with that nonprofit school of thinking a program is losing money when it's actually only losing money after overhead costs have been applied. But some organizations have the overhead costs embedded in everything else, and that can be a little bit tricky. But just wanted to let you know that this is kind of one way of representing it, and it's just something to always keep in mind when you're looking at your program budget, to be able to pull out what portion is overhead. Let me pause and see if there are questions. Okay, great. So in addition to budgeting, as a program staff, you might also be responsible for monitoring the programs. So you might get regular reports from your accounting systems that show your actual expenditures and revenue compared to your budget. So what do you do with this report? So like budgeting, monitoring is about more than just the numbers. Monitoring is figuring out if you want to change things in this year, and also it's a time for you to reflect and assess how things are operating. So my recommendation is before you even look at the reports, that you consider what's going on internally and externally, and ask yourself if any of that is going to affect the financials. You might want to think about leading indicators. These are indicators that might suggest lower revenue or higher costs in the future. So this could be low attendance at a lot of your community events or low conference registration. After thinking through all of this, then it's more helpful to go to the report and compare your budget to your actuals. See if you can detect any of those things that you think may potentially affect your numbers in your accounting reports. Or ask yourself if they're going to show up some way later and how they're going to affect your program. You also may want to just take a close look and focus on large differences between your budget and your actuals. And ask yourself why. Why is something different? What's the story behind it? Sometimes it's just seasonal activities, so maybe you just have low activity in the summer or the holidays. Or it could be a one-time fluke. Maybe revenue is really high because you got an unexpected one-time bequest. Or is it a sign of a longer-term trend? Maybe there's a change in the funding environment that's going to make it a lot more difficult for you to secure resources for your program. And then obviously once you've kind of assessed what the reasons are, you want to ask yourself what the impact is. Is it something something to be concerned about? Is it good news? In which case, if you have extra money, do you want to save it for future use, or do you want to spend it this year? And then you figure out what your next steps are. Contacting others in your organization, your executive director, other program directors. It might be that if your program's suffering but the rest of the organization is doing well, then you might be okay. Or you may need to revise your budget, or you may need to revert to a backup plan. Or, especially if there's kind of long-term changes, you may need to revisit your business model and figure out if there's a different way that you need to fund your program or run your program given the financial resources that are available. Questions? All right. So I also want to acknowledge that as a program staff or a program director, it can be very frustrating to be in your position some of the time. Right. You might want to increase services, but maybe the head office tells you to tighten up. Right? It seems like they're really out of touch with the needs of the community, or they're way too numbers oriented. Right? You're a nonprofit. You should be caring about service. Why are you so worried about money? It does look different from an executive director or a board's perspective. They might be acting the way they are for good reasons, making sure that the organization can stay sustainable. That doesn't necessarily mean that they're doing everything perfectly or they're making the right decision, but I do encourage you to give leaders the benefit of the doubt and communicate with them. Try to understand what their perspective is, what their concerns are, and then share your own concerns. And then see if there are certain areas where you might be able to help or take responsibility. So if you can raise extra funds or find new ways to do things that save money for the organization, then maybe you can use some of those savings for your own program, or at least make your organization as a whole financially healthier. So just a couple of tips for communication. It's really, really easy when you're communicating financial information to get caught into the details, right? So before you know it, you're trying to explain why you need a $1,000 increase in one of your line items. So my encouragement is that you really want to keep it simple. And it may even mean taking your budget template and kind of rolling it up so it's just the big picture. You want to make sure that you don't get derailed by the little details. And then as always, it helps to tell the story behind the numbers. Translate what the numbers mean in terms of your program and your people. So maybe you're concerned that you're not allowed to have any raises for your staff because program staff might leave for better opportunities elsewhere, or maybe morale is really low, and you need a way to recognize that you value your program staff even if you can't give them raises. So this may mean asking if there's a possibility that they can get extra vacation time or have some more flex time available. But making sure that you're not just talking about the numbers. Talk about how it's affecting people, how it's affecting your clients and your community, and really be able to bring out the human side of the numbers. There's always a human side behind financials, and you want to make sure that comes out, especially as you talk both internally to others in your organization as well as externally to other stakeholders. You don't want to seem like you're someone too focused on the numbers. You want to tie it back ultimately to the mission of your organization. So I also just wanted to share a couple other resources for financial management. And once again, I really want to emphasize that financial management is more than just numbers and more than just budgeting. It's really about thinking about ways to obtain resources in order to run a sustainable and successful program, and then translating those numbers into day-to-day accountability and operations. So financial health is never going to guarantee the success of your program, but it always supports it. And I hope that this webinar has given you a better framework for thinking about financial management and given you some ideas on how to improve your financial management skills. So I'm happy to stay online to answer some questions. And I know that Vanessa has a few words to say to wrap things up.
Yes, thank you, Linshuang, for a wonderful presentation. And so let me just quickly switch on over here. And so the slides, resources, and a recorded version of this webinar will be available on the Capacity for Health website at www.capacityforhealth.org. You can also find and register for any upcoming webinars and trainings by going to our upcoming trainings and webinars page. Of course, feel free to contact us for any of your capacity building assistance needs via phone or via email, whichever one is most convenient for you. And one of the many ways that you can stay in touch with us is by signing up for our mailing list. And as I mentioned previously, we are funded by CDC to provide free capacity building assistance in a number of different areas. Thank you once again for your participation in today's webinar. I'm going to go ahead and close things out, and Linshuang will be staying on for a little while to answer any questions you might have. Thank you and have a great day.